Hi everyone, my name is Kelsey Shane. I'm the Marketing Director at the Canadian Digestive Health Foundation, and I'd like to welcome you all to our webinar this evening on cannabis in gastroenterology. For those who don't know CDHF, we are the official foundation of the Canadian Association of Gastroenterology, which means we are directly connected to Canada's leading digestive health experts, physicians, scientists, and other healthcare professionals. So you can trust us to provide you with practical, science-based information that is up to date and unbiased. Recently, there has been a surge of attention on cannabis, with it being legalized on October 17th. We are very excited about how the legalization may make it more accessible for increased research on the medicinal uses and safety of cannabis. Cannabis in gastroenterology is our topic for the webinar this evening, which has been made possible through an unrestricted educational grant from MedRelief. Thank you, MedRelief. Our presenters this evening are Dr. Schneider and Dr. Andrews. Dr. Christopher Schneider is the Assistant Professor of Gastroenterology at the University of Manitoba in Winnipeg, Canada. His practice mostly involves the treatment of patients with IBS, Crohn's and colitis, as well as liver disease. He has been one of the major voices advocating for an evidence-based approach to cannabis therapies, so we are very fortunate to have him on the webinar tonight. We also have Dr. Christopher Andrews. He's a gastroenterologist and clinical professor in the Department of Medicine at the University of Calgary Cummings School of Medicine. He's also a director of the Calgary Gut Motility Center, and he specializes in motility disorders and physiology, in addition to development of novel diagnostic and therapeutic methods related to gut function. So thank you, Dr. Andrews, again for joining us. We also have two individuals joining us this evening who deal with GI disorders on a day-to-day basis, who will be sharing their experiences with medicinal cannabis, and I'll introduce you to them a little later on in the presentation. Just a couple of housekeeping notes. This is a live presentation. During it, if you have any questions that come to mind, please enter your questions in the question box at the bottom left-hand side of the screen. If you want to have a specific doctor or patient answer your question, please indicate who you would like it to be directed to, and questions will be addressed at the end of the presentation. We do have about 250 people registered for this evening, so we anticipate a lot of questions. So we will do our very best to answer as many as possible. But if we don't get to it, we will post the answers on our site in the next coming weeks. So without further ado, I'd like to welcome Dr. Schneider and Dr. Andrews, and we will start with the presentation from Dr. Andrews.
Great. Thanks, Kelsey. So as she mentioned, you know, I'm a gastroenterologist, so I specialize in digestive diseases, and you know, in the GI world, we have a number of diseases and symptoms that often don't have very good treatments, to be honest. And so, you know, with the advent of cannabis, especially medical cannabis, coming to the forefront, it definitely seems that there may be an opportunity, or at least some hope, that we can improve gut symptoms in these diseases. You know, it is early days, and so the aspect of medical evidence and clinical trials is growing, and it's underway in a lot of cases. But you know, a lot of this has not made it to mainstream yet. We're also living in a very historic time. You know, this is next week with legalization of recreational marijuana. I think things are going to become very interesting in terms of where things are with medical use and recreational use, because you know, this really in history there has not been a medication or a substance that's been simultaneously approved both for medical use and for recreational use. It's very unusual. It's very interesting, and you know, it's actually kind of exciting to live in these times and to see where these things go. So, anyways, we're going to have a talk tonight, and Dr. Schneider will join me hopefully soon. But we're going to talk a little bit about the cannabis in general, what it is, the different kinds.
When it runs out,
we're also going to look at the evidence base for cannabis and cannabinoids, which are derivatives of cannabis. And we're going to talk a little bit about the way it works in the body. We're going to talk a little bit about side effects and things that can happen if when you use cannabis, and then finally, and the doctor part is probably only going to take about 15 to 20 minutes because it's only really half of the focus here. We're also going to have two patients who have very kindly agreed to join us for the webinar tonight, and we're going to get their perspectives and get some real world talk about how it works for them, how they use it, how they started to use it, and so forth. So with that, I'm really interested to get going here. And like I said, we will have time for questions, but I think for the initial part with my talk, we'll save the questions for after, unless you want to do them online, in which case I can see them in real time and address them as we go along. So as you know, there's different subspecies of cannabis, and there's the indica and sativa are the two most common ones. There are other ones that are used for hemp, but the ones that are typically used as medicine are the sativa and the indica. And if you look at pictures of the plants, they do look very different. And generally, the makeup of the cannabinoid flower, the cannabinoids in it, can be very different. The indica is generally has a profile of cannabinoids, the cannabis active reagents that is a bit more sedating, and more like you can feel it in your body, often in terms of body buzz, and that it can be helpful for things like pain and so forth and sleep. Whereas the sativa plants are often have a much more sort of cerebral aspect. Many people find it helps with thinking or energizing, and whereas the indica could be a bit more of a sedative type. So the way cannabis works in the body is that there's a number of chemicals in there, and THC is probably the main one. And what that does is it actually stimulates the body's own cannabinoid receptors. So the human body, we actually make our own cannabinoids. They're called endocannabinoids, and that system is involved in sort of fine-tuning neurological and, to a lesser degree, immunological function in the body. And so your body makes these things, and the endocannabinoids, and the receptors are on nerves throughout the body. There's a lot of them in the gut. There's obviously a lot of them in the brain, and although they are not truly neurotransmitters in and of themselves, they modify nerves and how much neurotransmitter is secreted from regular nerves. And so the nice thing about it is that while it can definitely modify nerve function, it doesn't block it altogether, for example. And so that's why the safety is so excellent with cannabis, at least in terms of, you can't overdose and stop breathing like, say, narcotics or fentanyl, because there aren't that many receptors on the brainstem. So it really doesn't affect too much the way you breathe. It does increase your heartbeat a little bit, but these cannabinoids, they really focus on nerve function. And so when you take cannabinoids from the outside, so when you smoke cannabis or when you eat it or ingest it whatever way, there's the chemicals in that stimulate the body's own cannabinoid receptors. And so the main one, there's actually a number of principal ones, but the two main ones are THC and CBD. And so THC is the one that has been known about for the longest time. It was first sort of characterized back in the 60s. But that's essentially the one that makes you high when you smoke cannabis. It binds that CB1 receptor, and it exerts its effect on the body. And so the THC content is the one that has its effects on pain relief, reducing nausea, and improving spasticity in multiple sclerosis, for example. And it's also one of the main ones that's involved in increasing your appetite or giving you the munchies, okay? It's also the one that has the most psychoactive properties. So THC is the compound that does make you high, and the more you take, the more intoxicated you can get or stoned. And so on the flip side, the yin to the yang of THC is CBD, or cannabidiol. And that is a cannabinoid that works a little bit differently, but it can somewhat modify the effect of THC, at least as far as we understand it. But it can, on its own, have anti-inflammatory properties. And what they often say is, although it's not intoxicating, it is actually still somewhat psychoactive, in the sense that you may not feel any difference if you take CBD, but there's no questions that at high doses it can be useful for things like seizures, preventing seizures, and studies have also shown that very high doses may be useful as an adjunct treatment or a side treatment in things like schizophrenia. It's very fascinating how these work, and it's still not fully understood how THC and CBD interact, and but generally, when you purchase cannabis, medical cannabis, the two big features that they're going to talk about are the THC level and the CBD level. Moving on. So we talked a little bit about how cannabis works, and the cannabinoids generally, if you just take them off the plant and eat them, they won't actually generally have much of an effect, at least for the most part. You do have to heat them up to activate those cannabinoids, and that's why generally if you buy oils, they get processed so that you can just eat them, or obviously if you vaporize or smoke them, that will activate them. So I'm just going to skip through that slide. Now, there's other components in cannabis, and so things like terpenes, the flavonoids, these are other compounds that actually give you gives it that skunky smell or the funky smell, and there's also purported to be changes in the way that the actual marijuana works, depending on the terpene and flavonoids. Again, those we don't know as much about those as we do about THC and CBD, but there's no question that definitely gives you a different flavor and a different smell of the cannabis flowers. So, if using cannabis, as you may know, in the past, people have smoked it. People still smoke it. You can roll it in a joint or smoke it in a pipe. You can also use a vaporizer, and a vaporizer is a piece of equipment that actually just heats it up but doesn't actually burn it. And that lets happen is it lets the cannabinoids come off, and you can inhale them in a sort of aerosol form. And when you do it that way, typically you notice the onset of effects fairly quickly, typically within a few minutes, and the effects typically can last for a few hours, maybe up to 5 or 6. When you eat it, it definitely does feel a little bit different. It takes much longer for it to kick in when you eat it, anywhere from 30 minutes to even 90 minutes, and it lasts much longer. The metabolism is a little bit different, and generally for medical use, often edible is perhaps preferred because you're not inhaling anything. So it's not. We don't have any concerns with the respiratory system when you're eating it. And then there's also ways that you can put it under the tongue, and novel formulations which can have faster onset as well and can last more like an edible. So without getting too into details, the evidence so far states that we do have quite good evidence to show that it helps with chemotherapy-induced nausea and vomiting, neuropathic pain, spasticity, and the weight loss associated with HIV and AIDS. And so Health Canada has approved medications based on cannabinoids for these things. Now, the evidence is less good with IBD, and I'm going to talk more about that in a minute. But definitely for symptoms, there's a good rationale for it working that way. In terms of insufficient evidence, well, there's a number of things that are purported to help, and definitely when medical use became legal, it was touted as being worthwhile for just about anything you can imagine. In reality, that is probably not the case. It works for some things for sure, but it's not going to necessarily work for everything. And so, that's where time and research will tell what it's going to help with. There's a lot of promise, but the things where you need to be careful are in the psychiatric disorders. And in other things, but I think that, like I said, generally they are relatively safe in some ways, and so I don't think we could. It's too early to tell, to put it shortly. So when you talk about inflammatory bowel disease, there's no question that cannabis is helpful for things like nausea, diarrhea, abdominal pain. And cramps, and so it's actually been used for thousands of years for that purpose. The real question with inflammatory bowel disease is what can it actually do for the inflammation related to the Crohn's disease or colitis, and that's where the jury is still out. There's no question that there's been a number of small trials, and they work as placebo-controlled trials using cannabis. Smoked cannabis in Crohn's and colitis, and there was a signal or a suggestion that patients did improve. Definitely their symptoms did improve with that. But the real question is how much is the inflammation improving? And so, there's more research that's underway. There's a huge amount of interest in this, and this is good if you actually suffer from IBD, because what you want is research in your field or in the disease you have. And so I think we'll know better moving forward. At this point, however, there's not enough evidence to say that you can use cannabis as a treatment for your inflammatory bowel disease, okay? The drugs that are on the market have been tested very strongly, to a very high degree. And so the ones, Health Canada approved treatments for IBD, if you haven't tried them yet, the general medical idea is that you should try those before using cannabis as a treatment for IBD. But like I say, there is some evidence there to support that it may be helpful. Obviously, anecdotally, a lot of patients use it and feel that it helps them. And so, we can, often support that moving forward, but that's something we could talk a little bit more about when we get to the patient talks, okay? Okay, if, looks like Dr. Schneider might be here any minute, so if you're there, Chris, you can just let me know. Sure. In the meanwhile, I'll just keep talking. Are you there? Anyways, so, looking at other GI disorders, it's very commonly used for abdominal pain symptoms. And like I said, if you have diarrhea or cramps, the general idea of cannabis is it does slow things down. It does tend to calm down overactive guts. And so we do think that it might be worthwhile in certain types of IBS, certainly if you have diarrhea type of IBS. And there's no question that in patients who have chronic pain, some studies have shown that it will allow people to reduce or even in certain cases stop opioid medications. And generally that would be a good thing because, obviously there's quite a lot of harms associated with chronic narcotic use. And so that is something that looks promising, and certainly in Colorado and some of the American states that have legalized cannabis, they have noticed that the prescription rates for opioids have gone down, and presumably that's because people have switched over to cannabis. So when you talk about side effects of the cannabis, if you've ever used it, you probably know that the classic side effects, you do get the dry mouth or the pasties. It can help, it diminish your short-term memory, makes you forget things. And it can also, in certain people, make them anxious. It can also make you quite sleepy. It does, through its mechanism of action, it does increase your heartbeats, okay? And so sometimes people perceive that as actually racing, but it is normal to have a faster heartbeat when you use this medication. That can be an issue, obviously, if you have significant heart disease or problems with heart rhythm. And it also can affect your blood pressure to a certain degree. If you're using it a long time, and obviously if you're smoking it, then lung problems is a big it's a big issue. So I mean, chronic cough, smoking is still smoking, and so if you're smoking multiple joints a day, some of the risks that are likely associated with tobacco would probably apply as well in terms of lung damage, chronic bronchitis, and that sort of thing. There's also no question that young people using cannabis on a regular basis is not advisable, and unless they've got some type of terminal illness. The brain is very changeable and developing at that age, and studies have pretty unequivocally shown that people, especially people in their teens, should not be smoking cannabis on a daily basis, and that can have a lot of harms. So we can talk more about that, but there are some things that we don't know about long-term cannabis use. So Chris, if you're there, you can hop in at any time. So in terms of safety, so when you do get a medical authorization from a physician, and the way that it works for the medical system is that you get a physician who authorizes you and to do that, and that's just a form you can get online from Health Canada. Very simple to do, and it just says that the physician authorizes the patient for this much consumption, this many grams per day of flower or what have you, and they can also specify what they're suggesting and for what disorder. And then you take that authorization to a licensed provider, and as you know, there's many of them, and you just you can either go online, or there may be clinics where you live that you can meet people in person, and will the healthcare professionals at either the licensed producer or in those clinics can work with you to figure out what would be the best approach for you, how much THC or CBD do you need in the cannabis, when should you take it, dosing, and those sort of things. They can also look at your medication list and see, is this a good idea if you're on this other medication, that sort of thing. But generally the idea with it is to start low, at a low dose. The idea is not to have too much in the way of psychoactive effect. You go slow and you actually stay low, because the main thing with medical cannabis is you don't need to get super high for it to work, and that's something that is important to understand. The medical effects can present themselves without having to be really intoxicated, and that's important. Obviously, if you're using it as medicine, you still need to work. You still need to go out and do things, and so that's an important point to remember. And for chronic conditions, generally we're thinking that oral dosage forms are probably the way to go. For people who, there are certain situations where people probably shouldn't use medical cannabis. If you struggle with substance abuse of other things in the past, generally, cannabis may not be ideal. There is such thing as what's called a cannabis use disorder, and people can show addictive-like behavior. There we go. And then obviously, if you have a history of mental illness, and you definitely need to be careful, and it's particularly things like psychosis. If you've ever had a psychotic episode or schizophrenia, it's really quite strongly recommended that you don't use cannabis, as evidence has shown that it can increase the risk of psychotic breaks or speed up the first psychotic break in people who are predisposed to schizophrenia. So if you have a family history of psychosis, you probably shouldn't use it. Really advanced liver or cardiac disease, obviously that's, typically those people are quite ill. And then obviously if you're pregnant, planning to get pregnant or breastfeeding, it is not recommended. So with that, I did already sort of talk about how you can access medical cannabis, and it obviously the formal route for accessing medical cannabis, that's going to continue going through the licensed provider. With legalization next week, you will just be able to go and buy flower and oil at your local store or online, and so obviously that may or may not come with the same degree of counseling as the medical cannabis would be. But the medical cannabis access program will continue moving forward. So there'll be two ways that you can access cannabis, but generally if you are considering doing it for a medical purpose, it is good to get that advice and the authorization as well, just so that you can be properly informed about the risk and benefit of that medication. So with that, is Chris here?
Okay, so thank you, Dr. Andrews.
Yeah, I'm here. I just had a few medical emergencies, but I'm happy to be with you guys now.
Well, welcome, Chris. I'm glad you're here.
Welcome, Dr. Schneider. All right, so thank you, Dr. Andrews, for that very informative presentation. We're now going to speak to two individuals who deal with GI disorders on a day-to-day basis, and they'll be sharing their experiences with using medical cannabis. So first we have Joanne. She is 56 years old and is diagnosed with gastroparesis in 2013, as well as several other conditions throughout her life, including hypothyroid, IBS, GERD, and acid reflux. She's used medical cannabis for 3 years now and finds it significantly helps her with nausea due to the gastroparesis, as well as increases her appetite. And for those who don't know, gastroparesis is a condition in which a damaged vagus nerve prevents the muscles in the stomach and intestine from functioning. So it prevents the food from moving through the digestive system properly. Some symptoms of gastroparesis may include nausea, vomiting, the inability to finish a normal-sized meal, can lead to malnutrition, severe dehydration, and this debilitating and sometimes life-threatening disease can affect people of all ages. And we also welcome Jason to our webinar. He is 37 and was diagnosed with ulcerative colitis at 20 years old. He recently was re-diagnosed with Crohn's disease, and he finds that medical cannabis helps him with the improvement of the day-to-day pain he deals with. And then for those who don't know what Crohn's disease and ulcerative colitis are, they're diseases that inflame the lining of the GI tract and disrupt your body's ability to digest food, absorb nutrition, and eliminate waste in a healthy manner. So as a result, those living with this disease may have abdominal pain, cramping, gas, bloating, fatigue, diarrhea, and loss of appetite. But if you're interested in learning more about those conditions, you can go to our website at cdhf.ca at the end of the webinar. So we're going to start off with hearing from Joanne, and I'm going to guide her through a series of questions just so you can better understand her experiences. So first question for Joanne, what motivated you to try cannabis for helping your gastroparesis in the first place?
Okay. Hi, everybody. My symptoms started way before 2015. It was, I would say, maybe a couple of years before where I was having an issue with my food and everything else. And from there, I was prescribed different meds to help my digestion, and it wasn't helping. I was getting worse and wasn't sure what was going on. By the time I got diagnosed, it was a couple of years after I got the test done to confirm I had gastroparesis. Going back prior to that, I was uninsured for almost a year. A lot of vomiting, a lot of hospitalization. And I was at the point I scared and didn't know which way to go. I was on the waiting list to see a GI for a couple of years. I had a family physician that wasn't sure what to do next, so I started doing some research on the internet and go more the herbal route and see what else can help with my gastroparesis and learning more about what it is. And from there, I found a lot of good support group to help me understand the cannabis, the plants itself, and I've learned from there about, I'm still learning today, the sativa, the hybrid, the indica, and I approached my family physician and see if I could go that route and try that route, but he was against it and told me I was going to go crazy and close the book on me. So I ended up going. I'm in the north, so I ended up having my son taking me to Lockwood Clinic, and from there, very, very good teamwork. Did a lot of tests, and they suggested me to try the medical cannabis. I got my prescription. Started with my licensed provider. Back then, there was no oil. There was just a dry flower. So I document everything, the strain that I took and what helped and what didn't. I tried a joint, but I just cough really crazy with that. So I invest in a vaporizer, and just a few puffs was helping me to help the nausea, the severe nausea I was having. I was following with a dietitian, and within a year she saw improvement. I was doing better in a way where I was able to control my nausea better. And my diet, I was told at Lockwood to stop the Ensure right away, which caused me to go pre-diabetic. So now, today, what I'm doing is beef broth and very, very, very limited diet. And I'm very happy that I went that route. My loved ones can have a better life with me, and I'm able to deal it better with mentally and physically.
And what type and format of medical cannabis are you using today?
Today, what I do is I do the oil from my licensed provider. I also do my own edibles. I started about maybe 5 months ago. I know exactly how much I put in my edible, and I know my measurement now, what I know what I need to, how should I say it? Like I'll give an example, my gummy bear, I know exactly in my 40 gummy bears how much THC, how much CBD I got in there, and when to do my dosing. I found the edible has a longer effect for my symptoms, but for the digestion, I found it takes between, I would say, 2 to 3 hours before I see the effect. If my nausea is really severe and I cannot control it, I'll vape. I'll use my CBD flower, my THC, and I'll vape just a few puffs to calm it down. And then with time, then I'll take my homemade smoothies, my broth, and then I take my edibles.
Okay.
And that's a daily thing.
Okay. And were you worried about any side effects, or have you experienced any negative side effects now that you've been on it?
At first, I was kind of worried, like I didn't want the high. I was taught that, cannabis is bad, it's a drug, don't touch it, and I never went that route. But with trying all the medication that I was on for my gastroparesis, I was not getting any better. And I said, I did all this research before I even started. And I find that with all the research and all the support I had, and I felt more at ease with it. And when I first started, it was like, okay, Joe, you got this, and just a few puffs, and it did calm me down. I do meditation, deep breathing, and trying to put my mind. And
And lastly, what advice would you give to someone who is considering cannabis? Or do you have any, did you experience any pitfalls along the way that you want people to avoid, or just have any general advice for others?
I would say definitely go slow. Microdosing, I call it. Start slow and then wait a couple hours if it doesn't help. And also with this strain, we all have different receptor, I guess, all have different effects from it. For myself, I find microdosing has been helping me a lot.
Okay, great. That's okay. Thanks, Joanne.
You're welcome.
Is there anything else you wanted to add?
I would tell anybody that's struggling with gastroparesis to give it a try. Don't be scared, and it won't hurt you. Like, I had a bad experience just the one time where I had made edibles a couple months ago, and it was brownies, and I took a little piece too much, and I ended up having, I guess they call it couch luck. So I just lay down on the couch and put on a movie, and I said to myself, I'll be fine. But now I know my dosage and when not to exceed and not, and yeah. And don't, like, have faith and hope and stay strong.
Okay. Thank you, Joanne. That's very nice.
You're welcome.
So now we're going to hear from Jason, who currently has Crohn's disease, and I will guide him through the similar questions. So Jason, what motivated you to try cannabis for helping with Crohn's disease in the first place?
Hello, everyone. So I first started with colitis, and when I didn't start smoking or trying cannabis as a route until about 10 years ago. Sorry. So I kind of regressed pretty fast. I had surgeries to remove my large colon and sort of rebuild one, so to speak, what they call the pelvic pouch, because my colitis got bad so fast. I was on prednisone for about 3 years, 2 to 3 years straight. So it made me steroid dependent. It took much more of the drug to have an effect on remission status. I was only in remission for about 6 months at a time. I was being hospitalized. I had severe blood loss and weight loss. So one time I was told I came pretty close to actually to having a bigger problem. So the dependence on the steroid and what it did to my bones, it gave me osteoporosis, and it wasn't something I could live with at 27 years old or 25 years old for the rest of my life. So I got off that, and then even with the surgeries, my quality of life wasn't improving. I was getting bowel blockages from the scar tissues. I was still getting sick with what they called which is now Crohn's, but they thought it was like a recurrence of the colitis in the pouch. So it wasn't helping. As the pain got worse, I was being prescribed Tylenol 3s, sometimes oxycodone. Even though those wouldn't help the symptoms at all, it would help the pain. So I finally said that I don't want to go down the route again with the prednisone, and I don't want to stay on these drugs. My dad was a pharmacist, so I grew up knowing the other side of what could happen. He worked in a methadone clinic for years, prescribing, so I heard a lot of stories, and I knew that a lot of people wound up taking methadone just because of opiate addiction and opiate use, and it is a very addictive route to go. I was able to get off it, thankfully, but it is very addicting, and it definitely made me want to take more. So I'm glad I'm off that. And when I started taking cannabis, it wasn't something I was approached on very easily. In high school, I didn't like it. I didn't like how it played with my mind. I didn't like the high. I didn't like how I couldn't sort of control my everyday habits, sort of like drinking. So I didn't use it. And the more I got pushed to use it, the more I kind of didn't use it. So it took me a long time, till about 27, 28 years old, till I tried it through friends. And a lot of my friends who had Crohn's or colitis used it and said that it did help, so I tried it. Very quickly, I found with my age and with my maturity that I was able to control the so-called high that I had if I smoked it in very little quantities. But then when I spoke to my current gastro about it, he was actually pretty much on board. He was supportive. He told me that he had patients who tried it, and he was very willing to provide me with all the documentation. I went to a clinic that was also very supportive with it and sort of guided me through the medicinal route and how I would get how I would get the prescription and go the legal route of it. So I tried it, and being able to experience different forms than smoking, vaporizing, so being able to try pill form or oil form under the tongue is much more beneficial to have that access to. Also not being able to buy it off the street, knowing what's in what I buy and knowing that it comes from a legal source was very reassuring. Again, like I'm an adult, I'm 37 now, I have a child, I'm married, I have a career, and I didn't want to jeopardize anything with the illegal status of it. Through university, I studied about cannabis, I studied law, so I knew very well the history of it. And to be honest, I saw it as a very different, quote, drug. I saw it as a plant as opposed to other drugs. So I started to see a lot of that side of it when I researched about it and saw the benefits that it was having on Crohn's disease. And with being recently diagnosed with Crohn's, it was a route, again, that made me want to try and go to. It helps. I have to say that it helps my pain. It helps my symptoms. It helps put me at ease. If I have a blockage, I could take a few puffs and my bowel sort of rest. Thankfully, I haven't needed any major surgeries for my blockages. A few times I've needed to go to the hospital for rehydration or just to have something a little stronger for the pain. But always when I'm released, when they want to prescribe me something strong, I tell them I don't need that. I'm good with Tylenol, and I'm good with what I use with my cannabis. And they're very impressed with that, to be honest. The ER physicians tell me times horror stories, and they have a lot of praise for me to want to say no to an opiate prescription, especially these days with what happens with them. So it was definitely one of those routes that helped. I do like to keep it away from my everyday sort of status today. I don't like to keep it near my place of work. Obviously, I keep responsibility with it. I don't drive with it. I smoke it at night. I smoke it away from people, just because I find it like cigarette. I respect other people's space and not use of that. So for me, cannabis helps.
Okay, that's great. You pretty much answered all of my prepared questions. So I just want to ask you, like I did with Joanne, what advice you would give to someone who is considering cannabis, and if you experience any pitfalls along the way that you'd want people to avoid, or just some general advice for others.
So I do think it's something that needs to be brought up to your current physician. The fact that my doctor knows about it, whether he agrees with it or not, it helps me that he agrees with it, but it definitely helps more that he's aware of it. I bring it to the attention of any ER doctor, especially if I'm going under anesthesia. I let them know just to be on the safe side, especially with increased heart rate. THC will definitely give you that high, so you have to be careful with that. And CBD with going the medical route does help. It is one of the bigger relievers. Though THC does help with sleep or pain, CBD I find helps more with the symptoms of Crohn's disease. So I try and use that more. And if it's a route you want to go, it is worth a try. But like the doctors here, Dr. Andrews and Dr. Schneider, I'm sure would agree, it's something that doesn't take the place of other medications. So like I'm currently taking Remicade and methotrexate to control my remission status and to control my major symptoms. And I have gone through multiple other drugs to where I have either developed reactions or just can't take them for other reasons. And this has become something in addition to use to help me through day-to-day life.
That's great. I think that's very beneficial information for people with IBD. So thank you very much, Jason.
You're welcome. Thank you.
You're welcome. So now we want to get to our question and answer period with the time we have left. And we've had several questions come through. So we'll try to get to as many as we can. And then if we don't get to them, like I mentioned, we will post the rest on our website. So one of the questions that we had directed for one of the physicians is, what would you recommend for patients' best carrier oil to use for GI disease such as gastroparesis?
I guess I can answer that one. So can I just clarify the question? So best oil from like which licensed producer? Is that the question?
It says best carrier oil to use for GI disease.
Okay. So does it mean, I guess, the mode of action? So I find for gastroparesis you want a slower release to be able to have a sort of a more sustained effect. So I find a lot of the soft gel capsules, a few of the licensed producers make them, and that's, I find that's quite helpful. So that's what I would go for the route in terms of the carrier mode of delivery for gastroparesis.
Okay, and another question to follow up with that is, what terpenes should a patient look for in the dried flower for gastroparesis?
That's one that's it's more patient specific. There's no evidence to favor one terpene over the other. So from a physician standpoint, I think it just comes down to a trial and error for the patient to try the different terpenes and different formulations, and then they see what effect they have. But at this point, there's no studies to show that one terpene is better than the other in gastroparesis.
Okay, and another gastroparesis question. What strain for dried flower would you recommend for gastroparesis? So sativa, indica, or hybrid?
Chris, do you want to answer this one?
Well, it's like Chris said, if you're looking for an anti-nausea effect, you probably want to have more THC. And the issue is, though, that the higher THC, the more anticholinergic effect you also get. And what that means is that the sort of gut calming or gut slowing type effects increase with the higher THC as well. So it's not entirely clear, what the precise strain you would use, but generally something that's probably a little bit balanced, meaning, a good mix of THC and CBD. You probably, you don't want to use pure THC and minimal CBD. It's probably something that you'd probably want to have a balance of. And again, slow dosing. The truth is that each patient is a little bit different. There's not a lot of evidence to guide us in gastroparesis. As you know, gastroparesis, the emptying of the stomach is already slow, and so if you overdo it, then it might make the stomach even slower, and it may not actually help your symptoms that much. So I think the idea is that starting low, keeping it balanced, and see what you think. Also, though, with the stomach emptying being slow, the absorption may be altered and unpredictable. And obviously, people with diabetes who have gastroparesis really struggle with that in terms of trying to regulate their sugars. It might be the same with edibles, and so either sublingual or even vaping might be reasonable for like acute problems with nausea and vomiting from the gastroparesis.
And so just to add in that, so just in terms of the particular strain, what you'd want to do is do more of an indica or a ruderalis rather than a sativa, because those are lower in the THC, as Dr. Andrews said that you want to minimize the THC in gastroparesis treatment. Now, that being said, a lot of the companies like to always sort of really divide their plants between the sativas, the indicas especially. And the way the plants have been bred, the agronomy of it is quite interesting. They've been crossbred for certain characteristics so much over the past century that the real sort of true sativas, like a purebred sativa or an indica, don't really exist anymore. They're kind of a crossbreed. And the way the companies they classify them now is they actually have a tester, so someone that tries out the different cannabis and describes if it's more of a sativa or an indica feel. So it's extremely subjective. So that's why it becomes even more confusing even if you were able to find these strains, because they're very, very crossbred.
Okay, and this question is for either Joanne or Jason. Did you guys feel that you needed to increase the dosage of the cannabis over time?
So from my experience, yes. I felt that I got more used to it, more adapted to it. It hasn't increased much. I smoke anywhere from 1 gram to 2 grams a day, and I would say I started smoking maybe close to 1 gram a day. So nothing crazy too much, but yeah, you do get used to it.
Okay, another question. Dr. Andrews mentioned obvious side effects of potential lung damage when smoking, but what about vaping? Is there any evidence that vaping is also not good for lungs? Is it better, is it worse, or similar to smoking?
The evidence suggests it's probably safer, mostly because combusting things makes all sorts of byproducts that are not good for you, and for obviously there's many things, many kinds of smoke that can cause lung cancer, for example. So tobacco is one of the obvious ones, but wood smoke, cooking fumes, all these things can increase your risk. And so smoking cannabis, to be perfectly honest, if you're doing it continuously for many, many decades, the risk is probably higher of getting lung damage and lung cancer. So vaping, as we mentioned, it doesn't actually burn or combust the flower, and so, or the oil. And so what it does is it brings it up to a temperature where those volatile compounds, the cannabinoids will essentially turn into a vapor, and you'll inhale them. And so it definitely seems that vaping is probably safer. Again, in medicine, things tend to be very conservative and very cautious, and so it's very hard for doctors to say yes, vaping is for sure safer, but everything's pointing towards suggesting that it probably is safer. And personally, I recommend to my patients that they do try and vaporize rather than smoke it.
Okay, great. Thanks, Dr. Andrews. Another question is, can you elaborate on cannabis hyperemesis syndrome?
Yes, that's one. This is a very sort of quick talk that we gave. The cannabis hyperemesis syndrome is a very curious disorder, and it's a situation where certain people who smoke cannabis daily, typically for many years, can get a paradoxical vomiting reaction or vomiting problem. And what can happen is they often will get this just intractable bouts of vomiting. And often they need to go to the hospital. They need to get medications to try and make that better. It's often associated with hot showers or bathing. People often find that when they get these attacks of the nausea and vomiting, that getting in a really hot shower can be helpful for calming down the symptoms. There's a lot we don't know about this, and really scientists are really debating on what could be causing this. It doesn't appear to be a direct toxicity issue from like pesticides or anything like that. It's actually been reported all over the world with all those sorts of different strains and strengths and that sort of thing. So it doesn't really, there's a lot we don't know about it. It is probably a very small minority of people who use chronically who get this. People may have an associated anxiety disorder. So, like we were talking about, if you have mental health issues or really severe anxiety, then maybe chronic use from a very young age is probably not going to be good for you. But like I said, there's a lot that doesn't seem to be known about it. In the medical literature, they do suggest that if you stop smoking, if you stop using cannabis altogether, that the symptoms do abate. In my experience, that is not always true, but in people who do stop, it can take a long time to actually see. And so sometimes people, they may stop for 2 weeks and they say, well, I stopped for 2 weeks, I didn't get better. As you know, a lot of the cannabinoid residues can live in the fat in your body, and it takes a long time for them to work themselves out. So if you have problems with chronic nausea, often nausea in the morning when you wake up, or vomiting bouts where you're going to the hospital, and you're using cannabis every day, then at this point, the the best treatment seems to be to stop the cannabis completely and see what happens. They are actually looking at other drugs. We're actually probably going to start a study in this later in the year with some colleagues looking at what it is about that. But to make a long story short, if you have problems with vomiting that have only started since you've been using cannabis, then you got to think about that. Sorry, I could go on about this, and this is not to say that it doesn't work for nausea and vomiting, because it clearly does. And Joanne has a very nice is a very nice example of that. But that's what we sort of think it is, but thankfully it does appear to be quite a rare side effect, considering the number of chronic users.
Okay, thank you. And what would your recommendations be for prescribing medical cannabis for someone with severe liver damage?
So that can be a tricky one, because there is evidence to show that cannabis can enhance liver damage, in particular people with hepatitis C, as well as likely because it increases appetite, it brings on an increased amount of fatty liver disease and something called non-alcoholic steatohepatitis. So it can definitely alleviate many of the symptoms that people are feeling from liver disease, such as nausea and vomiting and abdominal pain. However, it does have some risks, especially in the chronic use in liver disease. So it would have to be a case-by-case specific thing, and it would definitely have to have some very careful consideration by a liver specialist whether it was appropriate treatment for that patient or not.
Okay, and another question here. Does eating cannabis affect the microbiota?
Very interesting question. Yeah, very hot topic right now, the microbiota. Definitely, there's no doubt it will affect the microbiota. Everything affects the microbiota, and including the foods we eat, the environment that we're living in, where we travel, and especially if we're taking medications or antibiotics. So it definitely will affect it. There's no studies to show how it will affect it. There would be a sort of a theoretical risk of potential bacterial overgrowth in certain patients, because cannabis does slow down the digestive tract. So if somebody is already having a slower digestive tract, when they take cannabis, especially in edible form, it would potentially slow it down, and there could be more bacterial growing inside the digestive tract. However, the answer is yes, but no one knows right now how, whether in a beneficial or a negative way or in a neutral way, will it affect the microbiome.
Okay, thank you. Another question, can chronic cannabis use actually cause GI distress, such as nausea or vomiting?
I think that ties in with the cannabis hyperemesis question. It doesn't always have to be hyperemesis. Often people will describe just nausea or gut upset. Typically, it doesn't cause a lot of diarrhea necessarily, but often yeah. So I mean, I probably won't say too much more about that, but the cannabis hyperemesis is kind of where that ties in.
Okay, I think we have time for one more question. So how do you address patients who stop their meds and go on cannabis in colitis, for example, and then go into remission?
So for me, I've had a few patients do that. I still follow them. Even if it's maybe not my recommendation to do that, we still continue on our doctor-patient relationship, and I follow them and see how they're doing. One thing to keep in mind is, I think that time will tell whether this is just really it was the cannabis, whether it worked in these patients, or whether it was just a period of remission. So Crohn's and ulcerative colitis, they're autoimmune diseases. They relapse and remit. So there's times when patients are when there's a flare and there's a large amount of inflammation and there's immune reaction inside the digestive tract, and there's other times when the digestive tract, when the immune system's calming down and the digestive tract is quite calm. So whether that was just a coincidence when the person started taking the cannabis, or whether the cannabis actually counteracted a flare and brought it into remission. So really, it's just time will tell whether that happens or not. But there is patients that do that, and they feel that that's the right choice for them, and they have a right to to decide what they put in their bodies and what kind of treatment they take. It's really, I see my role as a physician as just a role to make recommendations and to help them out using the best evidence available. But at the end of the day, it's the patient decides what treatment they want to do. So if they do that, I still follow them. We do the blood work, we do the tests, we do the scopes if we need to, and we just see if this is the right thing for them or not.
Okay, great. There's just one last question that has to deal with gastroparesis. So they're saying, I'm a dietitian and was wondering if you were able to increase variety of foods in your diet, or does it continue to be limited to broths or smoothies, etc.?
Yeah, so the gastroparesis diet is quite limited. It does have lots of evidence that it works, it's something that hopefully over time, especially if other parameters like if the diabetes is optimized, or if there was a post-viral gastroparesis, depending on the cause, the hope is that gastroparesis will improve and the diet will be advanced. But at the start, the gastroparesis diet that the registered dietitians prescribe is quite difficult to follow, and it's definitely hard to follow long term. So it would be something that can be advanced, especially if the gastroparesis improves over time.
Okay, Joanne, did you want to weigh in on that since you have gastroparesis? No? Okay. Okay, so that's all the time we're going to have for today. I do want to give a special thanks to Dr. Schneider and Dr. Andrews, as well as Joanne and Jason for taking the time to present to us and share their stories and their experiences of using cannabis. As I mentioned, this webinar will be available on our website at cdhf.ca in the next few days for anyone who wants to review the content. And we did have quite a bit of other questions that we didn't get the chance to get to, so we will do our best to have those answered as well, and we'll post those on our website in the next coming weeks. So that's all for tonight, and everyone have a great evening. Thank you very much.
Thank you.
Thanks for hosting. Bye now.